On November 24, 2014, three non-governmental organizations, the People's Health Foundation and the Rakhine Thahaya Association in Myanmar, and the Care for Peace Foundation in the United States, came together to sign two agreements that formalize their shared mission to build and operate permanent health and medical facilities for the 50 million people who live in rural Myanmar. The signing of a Memorandum of Understanding between the Rakhine Thahaya Association and Care for Peace was immediately followed by the signing of a collaborative agreement between all three organizations. His Excellency U Za'i Mong, the Rakhine Affairs Minister of the Yangon Region Government, opened the ceremonies with a commentary that echoed Union Government and Ministry of Health views as he said, quote, "Today is a special day for all people in Rakhine State, as well as for all Myanmar communities. The signing ceremony is a new achievement of the health care for the people of Myanmar as we transition to democracy in Myanmar. It will be a new front line for the Rakhine Thahaya Association to provide care for peace for the people of Rakhine State so that there is no hidden vision by the year 2030. Dr. U Tan Sein, President of the People's Health Foundation, presented how he has been working with Care for Peace since July of 2012, when at the behest of President Thein Sein's office, he visited Care for Peace in California to initiate discussions regarding potential health and medical service systems and facility development collaboration. Since then, the People's Health Foundation has been staffing, supplying, and managing 30 rural health clinics in what the President has lauded as the People's Health Foundation's effort to, quote, bridge the gap between urban and rural health care, unquote. Dr. Dan Singh also explained how the People's Health Foundation has been mobilizing, staffing, and supplying the Care for Peace mobile health van, and how his foundation is helping design the prototype mini medical center. Ulamantine, president of the Rakhine Thahaya Association, presented how his organization's charter is to support, strengthen, collaborate, and act as a catalyst for strengthening the health, education, and social welfare of the people of Rakhine State. He also explained how his association has a direct link with the Rakhine State townships, the villages, state government, through local area representatives of the association in all townships of Rakhine State to expedite the planning and the implementation of the proposed projects and programs. Dr. Cha-Cha Ong, technical advisor to the Rakhine Thahaya Association and a member of the Central Executive Committee, then presented a slideshow that specified how the Rakhine Thahaya Association had formed a health and medical planning committee with several retired medical doctors, government officials, professional health officials with international and local experience, all who come from Rakhine communities to support, advise, and work with Care for Peace in a union-wide and a Rakhine state-wide fundraising initiative. Dr. Cha-Cha Ong summed up his presentation by saying that to achieve the Care for Peace goal, the government and the people will need to help and work together. Then my partner, U La Chi, Regional Director of Care for Peace and the founder of Care for Peace Myanmar, told the story of how Care for Peace Myanmar came to be, who is behind Care for Peace, and what Care for Peace has already done with the Ministry of Health, the People's Health Foundation, the Rakhine Thahaya Association, and with Dr. U Shui Tyne, the Chok Fu District Medical Officer, and many village elders. La Chi explained how on September 1st, 2014, the Care for Peace mobile health van began its journey to remote villages with a medical doctor and a nurse provided by the People's Health Foundation, and how by the end of only 3 months of operation, the mobile health team served over 1,200 patients, some of whom had never been treated by a medical team. La Chi then explained how our collaborative team of partners had recently taken a 3-hour boat ride from the Chok Fu seaport and a 1-hour hike to the Pantopin village where he was born, where the purpose of our visit was to participate in the official groundbreaking ceremonies of the first Care for Peace Replacement Rural Health Center. La Chi concluded his presentation, telling how the groundbreaking ceremony followed the ancient Buddhist tradition where the Buddhist monk who had previously blessed the building site hammered a wooden stake into the ground on one of the corners. Then it was my turn. Then it was Dr. Tan Sign's turn. Ulachi's turn. Dr. Ushui Tine's turn. And then finally, Ulamang Tine's turn. I began my presentation by saying that I wanted to first explain what Care for Peace is all about, how I care locally for my family and friends, and I have peace. Yet there is much to be done by caring globally, by building healthcare facilities and communities of care wherever there are underserved people in the world who are hidden from our caring hands, so that their peace becomes our peace. So the charge of Care for Peace is to provide the funds and technical support to our in-country partners as they help the 50 million people who live in rural Myanmar and help them build their own mini medical centers. That's mini because they will provide basic health and medical care to all who come. Medical centers because they will exist as telecommunication hubs that are linked to larger, more advanced medical centers in Yangon, the United States, and anywhere in the world where there are accredited and credentialed advisors who will connect with many medical center doctors, midwives, nurses, and even patients who are already beginning to own their own tablets and mobile phones. Reviewing the past failures of other well-intentioned projects such as these have led us to take the slower pace, almost 3 years so far, to allow each village to secure the capacity to own, operate, and maintain the centers with minimal financial support from the outside agencies. Critical to the success of each mini medical center will be to ensure that the facilities can be self-sufficient and sustainable before they are built. Which brings me to the micro-healthcare system concept that isn't really a new concept at all, in that it is a community-based enterprise for economic capacity building similar to the microfinancing initiative that helps individuals rise from poverty. And finally, I described the No Hidden Patient Accord that represents our collective resolve to use the available health information technologies to commence the creation of a lifetime patient record, which will begin to fulfill Dr. Tan Sign's dream and organizational mandate to provide universal health care for everyone who lives in Myanmar, regardless of their ethnic or tribal origins. While the Memorandum of Understanding between the People's Health Foundation and Care for Peace had already been signed in May 2014, Ulaman Tain and I signed the Memorandum of Understanding between the Rakhine Thahaya Association and Care for Peace, and then we all signed the Memorandum of Collaboration. 3 organizations, 2 agreements, 1 mission, that there will be no hidden patient from our care by the year 2030, because all of us care about those less fortunate than ourselves who also care for peace, as do we.
Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news talking this and that. Friends to you, don't waste your time. right, that's what you wanna do.